It's like anything, the more aware the consumer is, the better decisions are going to be made by that person, the better decisions you're going to make for yourself. I think right now we're all used to letting somebody else really kind of make those decisions for us. Is that what you're getting at?
Yeah, you go to a doctor, and here's a couple stats. 46% of the initial diagnosis are incorrect. So you go to a doctor and they prescribe some sort of treatment for you, and half the time it's going to be incorrect. And the average length of a stay with a doctor is 6 minutes. And so in 6 minutes, which is why, again, they're harried, they're trying to get through a bunch of patients,
right,
which is why they miss it a lot of times. And if the patient isn't interacting and the patient isn't engaged in the dialogue with the physician, that leads to improper diagnosis. And so that's one of the problems that occurs. So people have to take they've got to be more knowledgeable. They've got to be better consumers of healthcare.
For some reason, and the system has gotten to the point where medicine is treated unlike any other good or service. I mean, the best analogy I guess people are using in and out of government is the automobile business.
Mm-hmm.
And we have insurance for that, but it's not running out of control. Why is that?
When you think about car insurance, we all have car insurance and it's mandatory. And we have it for the simple reason that if we pull out of the parking lot today and get T-boned, we want to make sure that we can pay for that. And so it's going to be something that would be out of, or an extraordinary event. And yet on the medical side, you have insurance when you go to get a checkup. Well, you don't have, insurance doesn't pay when you go in and take your car for a tune-up.
Or gas.
Or gas,
yeah,
or to get brakes. In other words, routine maintenance. But that's what we look at for insurance, and we call it insurance on the medical side. It's really not insurance. We know we need to get checkups every year.
Like a prepay almost.
Exactly. We know we need to get our teeth cleaned and checked. We know we need to have annual physical exams. So these are the kinds of things that it's called insurance, but it's really not. So the way people should think about it in the economics, you have individual pools. And so for Cumulus, we have about 2,000 people. Here's how the business works. I think it's important everybody understands the economics. Take all 2,000 people, take all of their cumulative medical expenses for the year. So that's every checkup, every visit, every procedure, every therapy, heaven forbid anything that's catastrophic. All of that together for all 2,000 people, that's the total expenditures for Cumulus Healthcare. Then what the insurance companies do is they look at that and they say, okay, that's the tab, so call it whatever it is. Say it's $10 million for the company. They then plus up a administrative charge on that, so maybe it's 15%, so about $1.5 million. And that's for administering and paying those bills, and then that in turn becomes the healthcare premium for Cumulus. So they take the entire pool and say, here's what we think you're all going to spend for the course of a year. You're going to pay that money, and then we're going to charge you a percentage on top of that to manage the process.
And
that's
profit.
healthcare insurance.
And profit, of course.
And profit.
Yeah.
That's healthcare insurance.
Right.
And so it's not in a pool at large, it's the pool of our company and every other company that does this. And so this is why one of the things in healthcare reform, they're saying, can't we pool with other companies and get larger populations? But if you think about the Cumulus population as a whole as just a microcosm of the larger population, it's not going to be that different. And so those our 2,000 people have a cost. And so what happens is we then split that cost with the employees, roughly 60-40, and then everybody pays into that. So therein lies the problem. If the insurance company, which everybody's looking to the insurance companies right now, they really have no incentive to try to make that $10 million, $9 million, or $8 million, or let alone having that $10 million grow every year at 15%, so next year it's $11.5 million, because they're getting their percentage on top of it. So they have no incentive. In fact, they actually have a disincentive to lower healthcare costs. So that's one of the first things that are a problem.